Want to reintroduce yourself?
Yes, sure. I can introduce myself. My name is Madeline Bremmel, and I'm the executive assistant for the Alliance. And so I do admin support for the Alliance and building up our organizational stuff. And I also do communications related tasks.
And our executive director, who I hope can hear us and speak.
Yes, I can hear you, and I can tell you're hearing me. So you see two Sharon Finarelli's on the screen. I'm the real one. Wendy's the fake one.
Sorry. I'm not.
Yeah. And so, yeah, generally when the Public Health Association is having a meeting, we don't, or if we do, we integrate it and become a part of their agenda. But since we were having a little shift in administration of this event, the Health Council's talks, we just had a little lapse in communication about why we were canceling it this week. This month, so that we could encourage health councils to participate in the Public Health Association. So I think in the past, we sent out a message encouraging them to attend Public Health Association. So there might have been mixed messages, which explains why we're having so far and few between today. So I apologize for that confusion. And Cynthia, I know that you have been working for months and months and months on this. And so if there's something we can do to get Health Council input in another way or at another time, we really would love to do that.
Yes. Right. So Cynthia, how about if you introduce your team first, and then we can introduce others who are coming on board here.
Sure. So let me see. Let me pull up my list so I don't forget anybody. So Donna, do you want to go first?
Hi, everybody. Can you hear me?
Yes.
Okay. So my name is Donna Cedillo, and I am the Senior Program Manager at the CTSC Community Engagement and Research Corps. So I work closely with Cynthia and have witnessed all the work she's put into this document. So I'm glad we're moving it forward.
I'm going to stop share really quick so we can see our faces.
Yeah.
I think that's nicer. Okay, next I have George Garcia.
Hi, I'm George Garcia. I work in the clinic, the integration of special populations, and I'm the research concierge for the Clinical Translational Science Center. And I work with Cynthia and Donna closely on many of these projects, but they're the leads.
Thanks, George. And next I have Heidi Rischel-Brakey.
Hi, everybody. I actually share an office with Cynthia. Normally she sits behind me, but not today. But I'm happy to be here and happy to see this document moving forward as well.
Thanks, Heidi. And next is Julia Martinez.
Hello, my name is Julia Martinez. I work with everyone who has been introduced so far, with Donna, Cynthia, Heidi, George, and up next, Rachel. So it's nice to meet you all.
Thanks, Julia. And that's a nice segue to Rachel, who this is her first week on our team. So
hi, everyone. My name is Rachel Taylor, and I'm brand new to CIRC, and I'm really excited to help facilitate today. Thank you.
And
Cynthia, of course, is our presenter. Cynthia, why don't you do a quick introduction, and we'll get back to you later in the program.
Yeah, so hi, everyone. I'm Cynthia Killough. I'm the Community Health Specialist with UNM CTSC. And I also wanted to introduce again, Dr. Robert Ryan, who is supporting us. This document's been there from the beginning as well. Robert, do you want to introduce yourself a bit more?
Sure, thanks, Cynthia. I'm Robert Ryan. I'm on the faculty at the UNM School of Medicine, and I'm also the faculty director of the Community Engagement and Research Corps for the UNM CTSC, where all of us come from.
Terrific. Thank you. Thank you all. And let's see, we also have then Shaza. You want to introduce yourself?
Hi, Wendy. Good to see you. How are you?
Hey, excellent presentation, by the way.
Oh, thank you. My name is Shaza Stevenson. I currently actually work for the CDC Foundation, but I work directly with the New Mexico Department of Health and do pretty much large scale kind of operational systems work for NMTOH. I got a last minute invite via Sharon, so pardon my and joining the group. I hope it's okay.
Oh, we're glad to have you. Yes.
Thank you for coming.
Yes. In fact, I think you'll enjoy this presentation. It's kind of on target. Nicole, how about introducing yourself?
Hi, everyone. Nicole Romero. I work for the New Mexico Department of Health as a health promotion specialist. It's been a super busy day today. All their deliverables are due, so I'm working with them to get all that in. And I honestly didn't know if the meeting was now at 12 or 1, so I joined just in case.
I'm glad you
glad
did.
I did. It's great to see you all, and I work with Colfax, Harding, and Union County. So
great. Happy to have you. Glad you made it.
thank you.
How about Joyce?
Hi, I'm Joyce Runyon. I'm in Quay County. I'm the assistant coordinator here, and I have the pleasure of working with Cynthia and Rochelle Moon on our social media committee for our health council. Real happy to be here. And thank you for letting me say hey.
Okay. And Rose.
Hi, everyone. My name is Rose Matskin. I'm a MPH grad who works with Pivot Evaluation, doing evaluation projects around Albuquerque that are often adjacent to healthcare needs. And so I'm really interested to be here today. Thanks for having me.
Great. Happy to have you. So let me pause for a moment. And
You skipped Rochelle. Yeah.
did I skip Rochelle? Where is Rochelle?
Hi, I almost got out of it.
Oh, there you are.
Hi.
Sorry, Rochelle.
My name is Rochelle Moon, and I work with Quay County Health Council. I'm the prevention coordinator. And as Joyce mentioned, we both get to work with Cynthia on our social media committee. And so we know her. And so we came to support her today.
Thank you.
Excellent. Excellent. Okay. Well, we do want to pause for a moment with our and ask you to participate with us in our land acknowledgement. If Madeline can pull that up. So the New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on unceded territory and ancestral lands of the original people of New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while strengthening and respecting our relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And as we were saying the other day, particularly now when our land is in crisis, we really need to rededicate ourselves to working with the land protectors and keepers to keep our land safe and all its people. So thank you for joining us in that. And now I'm going to turn it back over to Cynthia, who is going to tell us and get some input from us on this wonderful work she's been doing on how can all of you researchers work effectively with health councils. Cynthia, it's yours.
Thanks, Wendy. So I'm going to just share the agenda again really quickly so we're all on the same page and we know what's going on. So our goal for today is this document that I've been working on with lots of different people. It's titled Ways to Engage with Health Councils. We were going to do breakout rooms, but I think because there's such few of us, we might just stay in this big room and I think it'll still work fine. And then we'll, at the end of the document, we're going to work through it in bigger chunks and sections. And then at the end, we're going to just do talk about the next steps and future directions for the document. And so first of all, I just wanted to start off by saying thank you so much to the New Mexico Alliance for giving us time on their schedule. I know it's so busy today, so thank you all of you as well for hopping in. I really appreciate it. And then thank you to my UNM team as well for your support in being here. Seeing as we're such few, to my UNM team, if you would like to hop off, I know it's been such a busy week and there's other stuff going on, like lunch as well. So if you would like to hop off, I can take it from here, but and you're welcome to stay as well if you already wanted to, if you already planned to. Either way is fine with me, but I just want to be respectful of your time as well.
Can I say that it's great to meet you all though and see your faces, because I expect we will be interacting with you frequently in the upcoming months. So thank you for coming.
Yeah, go ahead, Heidi, that's fine. So I'm going to start off by telling you a little bit more about myself. Hold on, let me get this. Sorry, let me just get this going again. Can everyone see it in presentation mode or is it in slide mode?
It's in slide mode. Oh, there it is. There we are.
Now it's in presentation? Okay, perfect. All right, so I thought it was really important to tell you a little bit about myself and my role for today. So I made you all a collage, which was really fun because I don't think I've done a collage about myself since I was like in 5th grade. But so I'm from Las Cruces. I am native New Mexican. I come from a Mexican family. So here's a picture of me when I was a toddler with my parents in a little city outside of León, Mexico. Growing up in Las Cruces, I'm the oldest of 3 kiddos. Here I am with my brothers. A fond memory I have is being able to go to White Sands at least once a year, if not more. When we lived in Las Cruces, it was so close and our schools took us on field trips all the time. So I love White Sands. And of course, I graduated with my bachelor's and master's from NMSU in psychology. And I like to joke that I bleed crimson. And until UNM gives me a degree, I still bleed crimson. And I've been married for 15 years. My husband is also a native New Mexican. And I have a little boy named Silas. He's 4 years old. And so why am I telling you all this? So in my current role, I'm the community health specialist with the Clinical and Translational Science Center. So here's a picture of my CTSC family, at least everyone who could make it that day when I told them it was CTSC picture day. And I think that like having a healthy state is so important. There's so many ways to get to health, but of course we all affect each other. If our community is healthy, our states are healthy. I want New Mexico to be a healthy place for my son to grow in. And so one of the avenues that I think is important to look at when we're looking at health is health research. So in my role at CTSC, I serve as a community liaison. And I want to learn as much as I can about health priorities in different communities in New Mexico. And this is so that researchers, clinicians that I work with at UNM on various projects can be well informed. So when I first started my job about 3 years ago, I found out about health councils and found out that they are just a wealth of information for me and others, which is just so great. But there was also a steep learning curve, and I felt overwhelmed with the amount of information I was receiving. There are things that I've learned over the years that I would like to share with colleagues, researchers, others who are themselves not members of health councils, but are interested in collaborating or want to start attending a health council. That's where this document that we're going to be looking at together comes in. This is a rough draft of things I want other academics, researchers, folks like myself to know in terms of engaging with health councils. This document has been in the works since the summer of 2021 in collaboration with others at UNM, such as Drs. Nancy Pandy, Robert Ryan, who is joining us today. We also had Dr. Andrew Sussman, who does community engaged work at the UNM Cancer Center. Dr. Nina Wallerstein at the College of Population Health has also helped me with this document and putting it together. And then, of course, from the New Mexico Alliance of Health Councils, Sharon Finarelli was there since the beginning. We were collaborating with her. And then this document is also passed through hands at the Alliance's board. And we realized from the very beginning that creating this document would not be possible without the health councils. And I also realized that while I could easily reach out to the health councils I frequent, I only attend a handful, and there's 40 plus health councils in our state. And I just wanted to make sure that we had a chance to give this to a greater voice of people than just the health councils that I attend. So today, I wanted us to look at this document together. Give me your feedback so that we can make this document as helpful as we can for others. So I'm going to stop sharing. And just right now, does anyone have any questions or comments so far? Okay. All right, so we'll move right along. So I want to ask everyone if you wouldn't mind just briefly going through and telling me of a time. I'm hoping that each one of you has attended a health council, but I want you to think back to the health council meetings that you've attended and tell me about someone who was an amazing presenter and why were they an amazing presenter? Why do they stand out to you?
And do you want this verbal response or do you want it in chat or either?
Either, but I do prefer verbal since we're such a small group. I think that would be, I always prefer verbal. But if you don't feel comfortable, that's okay. You can put it in the chat.
I don't mind starting it off either, but passion and knowledge, passion about the subject that you could tell that person really cared, and knowledge about the subject, and really wanting to connect to that community, to serve that community. You kind of get a sense of, is that presenter about their agency or their information, or are they really about building healthier places to live in New Mexico? And that comes more from almost more from what is not said than what is said.
Definitely, I agree, Sharon. Would anyone else like to share a presenter or a time that stands out to you?
I think Sharon captured those things perfectly. The one that comes to mind for me is when we had Dr. Avi do the suicide talk for our councils, and that was on Facebook Live and Zoom. And it was just a really great presentation. And I think it's because of what Cheryl said. You know, he had a passion about what he was talking for. He cared about the community he was presenting it to. And those are the things that make somebody stand out. And it's not just, I'm going to read this to you off a screen. You can tell that they are sincere.
Yeah, I agree, Joyce. And Avi is just has a heart of gold. I'm so glad that you were all able to see him doing that presentation. Would anyone else like to share?
I would. This is Nicole. So I've attended, I don't know how many health council meetings through Colfax, Harding, and Union, but the presenters I think that are the best are the ones that engage the audience and, you know, get their feedback and, you know, just get the group excited. So.
Absolutely. Yeah, I agree. Thank you, Nicole. All right, so I'm going to move us right along then, and then show you this document. So with all of that in mind, and I'm so glad that Joyce brought up a UNM person, because I'm really hoping that this document whenever I come across different people who want to maybe do presentations or start engaging with health councils, that I can pass this along to them just to help orient them a little bit more. And so the first thing that we are going to do is, I think it's important that we read this whole document together so that we're all on the same page, that you've heard it, that you have seen it, okay? So we're just going to start right along. So the title is Ways to Engage with New Mexico Health Councils. And this document was created in collaboration with members of the following, which you can see here. And then Wendy, would you, or Madeline, would you be able to help me keep track of chat as well? Just so, sorry, I'm not very good at multitasking. So that would be so helpful. Thank you. All right, so the purpose, this document serves as a guide to those who wish to pursue meaningful community engaged relationships to help improve health outcomes in New Mexico. This includes collaborations with local entities, including health councils. When I first started my job and attended various health councils, there was a steep learning curve and a lot of information to take in. I want to share what I've learned and help others who might not be from the health councils communities, but have a common interest in the community's health and well-being. Being a native New Mexican, I love my state and I want to encourage collaboration so New Mexicans can achieve their health goals. So that's a quote from me. And then we'll start with the background. New Mexico is unique in that there are currently over 40 health councils representing 33 counties and 9 tribal nations. Established in 1991 by the New Mexico legislature, reaffirmed in 2019 by the County and Tribal Health Act, House Bill 137, health councils identify needs, resources, and priorities to improve community health. The New Mexico Department of Health, DOH, Public Health Division, and DOH Health Promotions teams work collaboratively to support health councils. There is a growing interest from researchers, project coordinators, organizations, and others to attend New Mexico health councils as they provide a wealth of information about community needs and health priorities. Engaging with community members through a health council allows for collaboration aimed at achieving health policy reform, research equity, or social justice. Creating opportunities to demonstrate cutting-edge approaches to address community-identified priorities and understanding complex health problems by county. Recent collaborative efforts also aim to include local data for decision-making, which allows deep engagement with health councils to support community well-being. As interest in attending health council increases from individuals outside of communities, obtaining guidance and support can help interested parties better understand and respect the culture of each individual health council. We hope the following points help guide you in connecting with New Mexico health councils. Now for this next section, before you attend a health council, do I have anyone that would like to volunteer to read so that it's not just my voice?
I'd be happy to read.
Thank you, Rose.
Sure. So starting with before you attend a health council, do you want just that section?
Yeah, just that little section.
Okay. The following information may help to better understand health councils. Be familiar with legislation. Here, the County and Tribal Health Councils Act. Look at New Mexico Alliance of Health Councils fact sheets that tell you more about each health council's mission and goals. This can help you find the health council that aligns with your work and goals. Reach out to the coordinator to begin developing a relationship with the health council. All health council contacts are listed on the Health Alliance webpage. Ask the coordinator if their council meetings are open to the public. Cycles in development. Each health council is unique and cycles and stages of development. Each health council is unique and cycles, in stages of development, with some having more established membership structures, funding, planning, and implementation processes, etc.
Thank you, Rose. Do I have any volunteers to read tribal?
I'm just wondering, Cynthia, did you want comments along the way, or do you want us to make notes and save them until the end?
Yes, thank you for reminding me. Yes, please make notes. I think for now, I just want to go through the whole document together. If you have a paper and pen that might help you keep track of what you would like to say in each section, go ahead and jot those down. And then we'll go back and look at each section little by little once we've read through the whole thing together. Thanks, Sharon. So do I have another volunteer for tribal health councils and first time and ongoing attendance sections?
I could do those for you.
All right, thank you. Go ahead, Joyce.
Tribal health councils. None of the tribal health councils are open to the public. However, if a project is of mutual interest, you may be invited to attend. It is also important to note that the New Mexico Alliance of Health Council respects tribal sovereignty, respects decisions from tribal leaders, values, and recognizes community and tribal processes. First time and ongoing attendance. Once you are invited by the coordinator or other health council member, in the spirit of building trusting relationships, please attend health council meetings. If you attend in anticipation of making a presentation at some point in the future, pay attention to who is presenting, how long are they presenting, who's in the room, how often do guests speak.
Go ahead and keep going, Joyce. This section's part of the previous one as well, if you don't mind.
Okay, that's fine. Some health councils have a lot of room for open discussion while others have minimal. Some have formal presentations while others are more open and informal. Some health councils have executive committees, core teams, etc., that have created their own processes for presenters, participants. Before you present, know the Health Council's priorities, which are included in the fact sheets on the NewMexicoHealthCouncils.org website. In your presentation, describe how your work connects to the Health Council's interests and priorities. For organization and entities outside of the Health Council, ask yourselves, how can your work serve the community? If you're conducting a survey or engaging in other assessment or research activities, please plan to share the analyzed results back with the Health Council.
Thank you, Joyce. Can I have another volunteer for other ways to engage with health councils, and then the please share this document section?
I'll be happy to read that.
Thank you, Robert.
Other ways to engage with health councils. Join a health council committee. Many health councils do their work outside of their larger health council meetings through committees. Joining a committee helps the health council achieve their health priorities and initiatives, help you learn more about the community and establish relationships. Share resources, skills, knowledge, data in mutual areas of interest. Attend monthly health council talks. These occur every third Friday of the month, 12 to 1 p.m. Again at lunch. Can add anyone to email list, sorry. Provide information for the New Mexico Alliance of Health Councils newsletter. And then please share this document with others. This document was created in the spirit of supporting each other through our shared interests in community engagement through health councils. Please share this document with others whom you think would benefit from the information provided. Document housed on website to be included once document is finalized.
Thank you, Robert. And so that's the end of the main document. And on this last page, I've just included a list of the websites that were included throughout the document so that it's in one space. And then we added a little section for collaborators of this document to include, which will be filled in once this is a bit more finalized. So now I'm going to go back to the beginning. And if you don't mind, because I do want to also look at this at a later time, of course. So for now, if you have any comments, please put them in the chat for me so I can keep track and I can download the chat later. But then also if you wouldn't mind sharing verbally so that the group can hear your thoughts as well. But my first question are, what are your overall thoughts for the document in general? And please share in the chat. And then if you wouldn't mind, just also verbally share with the group now. And I'll give us just a little bit of time so we can gather our thoughts.
And I'm just going to share verbally first, then I'll put it in the chat. Two things. First, I think it's a great overview. And if there's a way to distill it down to a one pager that could be handed out to presenters from health councils, that would be really helpful. And I don't know if that's possible, but I think there's some really good points in here. And it's also, a little bit long if you were going to hand it out to a presenter to help them.
Thank you, Sharon. Yeah, I'm a big proponent of like having one pagers. I do like that idea a lot. So I will definitely consider that as I'm revising to see what can we cut out. How can we get that? I do like that idea a lot.
I have one question, and I'm sorry if this was mentioned already and I missed it, but is this document, other than for people who are specifically planning to present, I feel like there's a lot of really good like links and resources in this document. Is it going to be available in general?
Yeah, thank you, Rose, for your question. So we're hoping to include it on the New Mexico Alliance of Health Council's website. And then also I know UNM, we have a community engagement core, and we'll also be including it on that so that whenever we meet with others, whether they're at UNM or not, we do a lot of collaborative work also with like NMSU, other organizations and entities outside of New Mexico. So we want to be able to share this with as many people as possible.
Cynthia, I'm really happy to hear you say that, because one of the difficulties from the community perspective is there are numerous research centers at UNM and NMSU and I don't know where else. And we don't even know who they all are, but perhaps you are in a better position to make sure that this document and its permutations are in fact shared with those other research units at your institutions. That would be so helpful. It would also be helpful to know who they are.
Definitely. Wendy, and UNM is such a big place. Especially with CTSC, we do work with a lot of different PIs. There's medical doctors also at UNM who do their own research as well. So we're just so big, but I'm going to share this far and wide with as many people as I can. And hopefully, I don't know the best way to just gather all of those little, there's just so much that goes on at UNM. But yeah, I'm happy to share knowledge of what I know with you. I know that that's something that you're really interested in as well.
Cynthia, I really love all the information you have. In order to maybe make it a one-page present handout that you could do, you might separate the information like for tips for presenters as opposed to tips for people wanting to participate with health councils. And that way you could shorten out what the handout is, but you've got really good information there. I like the way you don't, health councils aren't generalized because they do run differently and they do operate differently. And so you're respecting those differences and making people aware of that when they're trying to reach out and connect with them. And most of our state is so rural and we have very few resources in those areas. So to have connections with people that are doing the research and doing the work, and that's huge to reach us out here on the edge of society. So thank you.
Oh, thanks, Joyce. I'm so glad to hear that too.
And Joyce, would you be able to summarize that a bit in the chat? Because I think Cynthia would like to have a reminder of what you said.
Yeah, Joyce, I think that's a great way to separate it. And maybe in that way, we can also, like Sharon was saying, having a one pager for presenters, but still being able to provide that context. Because I think for me also, when I first started attending health councils, you know, the House bill, I wasn't even sure how that fit into this. So I feel like this, at least some of this background would be helpful just to know. So I like that because then I get to keep both. So thank you. All right, do we have any last general thoughts before we start getting into like more of the meat of the document? Okay.
Shaza, did you want to say anything about your comment in the chat?
Sure, I'm just thinking, so, you know, there's two different documents or two different products you can create, one being an actual physical handout, which I'm not sure is relevant these days, or just a web page with the tips, and then you can even have those links built in, right, that they can get for more information or go straight to whatever you're referring to. So I think maybe just the web page perspective could get you a lot further.
Yeah, thanks, Shaza. Yes, and we have discussed that within our group too. And I think for now, because of just how the pandemic has just changed so much and so many meetings these days are virtual, it is nice just to have a website where you can just put in a link and then have them go straight to the document. But I do like the idea of having print material as well. So thank you. I do like that. So just out of curiosity, do you all think that this document would be helpful to someone? Is there someone you might have already in mind that this would be helpful to? You can give me a thumbs up or a heart. Thumbs up. Thank you, Madeline. Okay, so now let's get into it. So what do you think about the title? Do you think this captures what this document is? Do you have any suggestions for any other titles?
I think it expresses what you've got in the paper. And it's very engaging. It's an engaging way of talking about engagement.
Thank you, Wendy. Anyone else? Okay. And of course, feel free to always just put into chat any ideas that come on, even if we've moved on to a different section. Your comments and feedback are very much appreciated, and I'll be able to look back at what you say. All right, so now I'm going to skip the purpose and the background just for now, because it has gone through a very laborious and vetting process already. However, even though we are skipping it, again, if you have any comments or suggestions, please put it in the chat for me. And then even if later you think about something, feel free to email me as well. I'll provide that at the end. So now I'm going to go to, before you attend a health council, what are your thoughts on this section? And also, if you catch any grammatical mistakes, please share those or let me know, because later those bug me so much. So if you're a good grammar checker, please speak up and let me know as well.
I think this section is really good. I mean, you're giving them a lot of background information, ways to check who these health councils are, how they would work well together, who they might want to partner with. I think it's just really clear and good.
Good, thank you, Joyce. I'm glad you approve of this section.
I think it's really good too, but it's also important to have a coordinator who is excited to do this work and can, you know, rally the partners to actually want to do the work. Because I've seen in several counties, you know, their health council coordinator was like assigned the job. And that's a huge difference between the ones that volunteer.
Yes, Nicole, I've also witnessed that, and I agree with you. Coordinators are so important, and they can set the tone so often for the health councils. And yeah, they're just the backbone. Very appreciative of the coordinators that we do have, because it is a lot of work and there's a lot to follow up on.
It is, but you have some pretty amazing coordinators, like Mary Lamba from Harding County. You know, she is a nurse practitioner there. She works at the schools, El Centro, the health council coordinator.
Yeah, these people are amazing.
Mm-hmm.
Yeah, I agree. All right, so I'm going to move us right along in the interest of time. Tribal Health Council. So this section, I specifically reached out to Geraldine from the Alliance of Health Councils. And so she's the one that gave me this script. So I feel pretty good about this, and I'll make sure to reach out. She wasn't able to join us today, but I'll reach out to her again just to make sure there's anything else, or if anyone that's joining us now, if you attend a Tribal Health Council, please let me know if you think there's anything else we should add. I haven't had the pleasure of attending a Tribal Health Council meeting just yet.
I think it might be good here to include a link to the Tribal Connections page that Geraldine keeps up, because she's always got new information that she's posting on that page. And I think you will also then find on that page her email address so that people can get in touch with her. I always contact Geraldine when I have anything to do with anything for a tribal health council, a question or a suggestion or a potential research. I always check with Geraldine first.
Okay. Thank you, Wendy. And I'll make sure that she feels okay
Yes.
with me including that. But no, I think that's a really great suggestion too. So thank you. All right, so we're going to move right along. First time in ongoing attendance. How did you all feel about this section? You feel good? I'm going to take your silence as approve, or if you have anything to say, you can always put it in the chat as well. And then other ways to engage with health councils. And let me just say also from my experience, so the health councils that have these like subcommittees or just offer ways to volunteer, even if it's virtually, have been such a like great opportunity for me, because I feel like they are the ones that I really get to interact with a lot more, because sometimes in those health council meetings, they're just so jam-packed and there's already an agenda set forward, and sometimes it can feel hard to feel like you know anybody. And just like, for instance, with Quay County, with Joyce and Rochelle, it's been so great being able to do this volunteer work on the side, because I feel like I get to know them. I get to know like their health priorities a lot more. And so it's just been, especially during the pandemic, that has just been so great to me. And it's been really like fulfilling work as well.
Cynthia, can you scroll back up to the previous section just one time? I think it's important to I think it's important when you're attending a health council meeting that you're not just presenting your project or what you want to do in that area, but that you ask for feedback.
Oh, good point.
From the council, because they give such, they know the area better than anyone. So, yeah, I don't know, just in that section somewhere, I don't have a specific place, but I just wanted to make that it's an important point that health council be able to give feedback on their project to the whoever's presenting, researcher or others. In addition, and the other most important point is that I would strongly, maybe even more strongly, say that you should come back and present your results to the health council. That has to be a must. That's in there in the next paragraph, but that's really important in my view.
Yes, I agree, Robert. You know me, I'm a big proponent of dissemination of results and findings. And I think it's been so great when we have had researchers who have been in communication with us, who we get to go back to the health councils to present our findings back. And community members remember us. They remember when we first present these projects to them, and they remember us when we come back. So I think it's such a great way to go full circle.
I'm not sure where this would go either. At some point you referred to assessments. And one of the things we've been dealing with lately is how to, I'm going to say, protect health councils from the many, many, many research projects that are going on in their community, for which they're asked to either provide input or to see the results from. I don't know if Sharon wants to say anything more about recent attempts now, for example, to try to coordinate the health assessments. Sharon, I think you told me that one health council had more than one assessment going on in her community. So if people if researchers could, maybe even before they conceptualize a research project, connect with the community and see if in fact anybody else is doing something similar.
I agree. That was Grant County that just in the first 2 weeks of new coordinators, she found out there were at least 17 community health assessments of one type or another being done. And so I think what happens is people tend to start a project and think a survey is the best way to get information without taking into consideration what's already out there. And it really contributes to survey fatigue for communities. And I think it also skews the results of those surveys as a result. And so I would just encourage anyone, when you're working on a research project, please check for existing data. And one way to check is ask the Health Council, but also ask the Alliance, because we also keep libraries of research. Share New Mexico is a program of the Alliance, and that also has a whole lot of libraries of different data sources. And so I would say beyond your traditional resources that you check for data, check for what else has been done, and make sure that the information you need isn't already available before you do one more survey.
Right, or that a project similar to yours is not in the works for that.
Yeah, that you could partner with, that would even be better, theoretically. I know partnership isn't always easy because you're fitting with constructs of classes or timelines or whatever, but it sure does make it easier for the community, and I think more useful for the community. If that's the point of the research, that would be really helpful.
And I would add to surveys also, we're hearing that there are a number of community conversation convenings that are happening at the same time, all targeting the same people.
Or similar topics. And so if we can help to make a connection so that we're doing one community conversation on a topic or two instead of trying to get multiple out. It just decreases people's interest in participating when there's too much. And often in frontier and rural communities where populations are small, it's even more challenging. And I think it doesn't give us good data as a result, because your sector response is probably the same people who have the time or interest in responding get overplayed. And the diversity that you're really looking for is underrepresented.
And that's one of the functions, as Sharon said, that the Alliance could serve, is really helping you connect perhaps with the counties that are most likely to be concerned about your issue, or that have resources or don't have resources to support your effort. So as Sharon said, we'd be happy to talk with any of you that are interested in doing something like that.
Yeah. Oh my goodness, Wendy and Sharon, that is such a great point. Yes, and like you said, it affects data. I know I've heard from different health councils before that they're surveyed out, you know, from other entities coming in. So I like that idea a lot, of just trying to do your best before you even approach them, to collaborate with others, coordinate, find out what existing data there is. Can you use their data, pop on? Yeah, that's such a great idea. Okay, so that is the end of the document. And because I want this to really be a collaborative effort, I know, like Wendy said, this is an initial start to this conversation. But at this time, because all of you were here today, I would love to add your name and affiliation as contributors to this document, because you're helping me to make it better. And I don't want to take the credit. This isn't something that I can do or want to do by myself. So if you are okay with us adding your name and affiliation to the end of this document, please put your name and that affiliation in the chat so we can include it. If at a later time you are like, Cynthia, I don't want my name on this, that's okay. My feelings won't get hurt, I promise. You can email me. I'm hoping to get this finalized by the end of the summer. So by the end of July, I'm going to reach out back to Sharon, to the Alliance, get all the information that was shared today, get this updated, try to work out some of the suggestions and feedback that you all gave me. So you have until July to decide. Even maybe today you're like, I don't know, but maybe at a later time. Again, by the end of July, if you reach out to me, then I can add your name. And let me put my email in the chat really quick. And again, just thank you all so much for being here today. I know that there was so much going on, and I just really appreciate you looking through this document with me. It helps me feel more confident about this document and just wanting to share the work that the health councils are doing, because I think they're amazing. All the ones that I've attended have been amazing and so incredible. And I just want others to know about them too. Thanks, Rochelle.
Thanks so much, Cynthia. I really appreciate your hard work and your attention to detail and engaging a variety of voices in reviewing and contributing to your work. Thank you.
Thank you, Sharon.
Thank you very much. If you go to our website, nmhealthcouncils.org, please do take a look at our calendar, because there are a lot of events happening here in this month, the rest of this month, and the beginning of the next month. So take a look at that, and feel free to join in at any time. I do want to say that we are having another Health Council talk next Friday. This time it'll be from 2 to 3. And we have two presenters. Jessica Cowdery is going to tell us a little bit more about this new constitutional amendment that the populace has to vote on in November in order to allow distribution of the trust fund monies to early childhood funding. So that's been in the works for 10 years, and it's now reached the stage where the New Mexicans get to vote on it. So she'll be giving us information about that. And then also Athena Huckabee is going to tell us about a new treatment option for some kind of new kratom youth use disorder, which is another substance use challenge that is emerging on the scene here in New Mexico. But there is, fortunately, treatment available for that. So she's going to tell us about that. So join us on next Friday. Sharon, I don't know if you want to say anything about the Monday meetings session.
Oh yeah, so part of our CDC trainings around capacity building, we're having a workshop on stakeholder engagement. We'll have a couple of legislators joining us and then some health councils sharing how they work with legislators. And like everything we do is open to anyone who wants to come. So all of that information is on our website. If any of that sounds like something that would be interesting to someone you know, please share that with them. And we would love to have you participate in any of our activities. Thanks.
Yeah, great. So any more questions, last words, last thoughts for Cynthia or the Alliance? And if not, we want to thank you all, especially those of you that stayed with us to the end. Appreciate it. And as Cynthia said, we're looking forward to carrying on this conversation beyond today. It's really such an important source of collaboration, win-win resources for everyone here, as long as we do it correctly. So thank you, Cynthia, very much. And we'll be back in touch with all of you. So thank you.
Thank you.